Good day, I am Nachaluddin M. Morales from PSN1 M78. So today we are doing a third demonstration of cold compress and hot compress. To demonstrate the proper technique in applying hot and cold compresses, ensuring the patient's safety and comfort while achieving therapeutic effects such as pain relief, reduction of inflammation or swelling, or improvement of blood circulation. For step 1 to 6, same procedure and patient for hot and cold compress. Step 1, verify the doctor's order for the cold compress and hot compress, including the type of moist, cold and hot application, location and duration, and desired temperature. Step 2, review the client's chart for medical history and contraindications such as poor circulation, impaired sensation, or vascular diseases that may contraindicate the cold and hot compress. Step 3, gather all the materials near the bedside. So we have gloves, waterproof pad, compress bag with ice, alcohol, washcloth, basing with the warm water. Next, we will perform hand hygiene and apply clean gloves. Next, grade and identify the client using the 3 identifiers. Good day, ma'am. I am Nachaluddin M. Morales, your nurse for today. May I verify your full name po?
Andrea D. Flores,
Your birthday po?
March 2020.
Your age po?
17 years old.
Can I check your wristband po for verification? Thank you po. Then, provide the privacy at all times. Since we are in a private room, I already closed the door. However, in ward, we will close the curtains. For the cold compress procedure, assess the client's and family awareness, understanding of the procedure, and related safety factors. Can I ask you a question po, ma'am? Have you or anyone in your family ever received a cold compress before po?
Yes, but it was a long time ago.
Okay. Then, explain the procedure to the client clearly and completely with the client's approval. I will explain the procedure to you. The doctor ordered a cold compress to help reduce the swelling and relieve in the pain on your knees po. Cold compress are generally used for recent acute injuries with swelling, inflammation, or pain po, and reducing for fever po. They help by numbing the area and slowing down the blood flow to the injured area. We will leave it from about 15 to 20 minutes. Will that be okay with you po?
Yes, it's fine.
Then, assess the vital signs and mobility of the patient. I already assessed the patient vital signs and mobility earlier. Everything is within normal limits, and she is safe for the procedure. Then, identify the expected outcomes. I will clarify our goal is to reduce the swelling and make your knee feel more comfortable and less painful po. Then, describe the sensation patient will feel and precaution to prevent friction and numbness. So, I will describe the sensation that you may feel. It is bit cold, sun tingling, or slight numbness, which is normal po. But if you feel intense, cold, pain, or burning, please tell me right away po so that I can stop the procedure po. Then, position the patient in bed. Keep the affected body part in proper alignment. Expose the body part to be covered. Drape the patient as needed. So, I will help you position your leg po slightly elevated and keep the rest of your you covered for warmth and privacy po. It is okay for you po?
Yes.
Then next, assess the client's skin around the area to be treated and the client temperature and pain sensitivity. Then, inspect for wounds or any wounds. There are no wounds or open skin in the area, so we are clear to proceed. Place a waterproof pad under the knee. Placing a waterproof pad under your leg to protect the bed linens and prevent moisture po. Next, before I apply the cold compress to the affected area, I will check the temperature of cold compress and we will apply it. I'm applying the cold compress na po. Let me know if you feel too cold or uncomfortable to reduce the inflammation po. Then next, monitor comfort and observe skin during the application. How does your knee feel now po?
Feels cold but less painful.
That's good. I will check your skin every 5 minutes and observe your reaction closely po. Please let me know if anything feels wrong and to avoid cold injuries like frostbite or skin irritation po.
Thank you.
Okay, ma'am. After 5 minutes, I will check the temperature of the cold compress. If needed, remove and remoisten and reapply to maintain the cold temperature as needed. Since the cold compress bag with ice is still same temperature, we must not remoisten it. Then, stop the application immediately if any untoward incident or problem occur. Ma'am, I will be back at 20 minutes po. After 15 to 20 minutes, remove the compress. So, it's been 20 minutes po, ma'am. I'm now removing the compress and drying your skin to prevent prolonged exposure which can damage your tissue po. Inspect the skin post-treatment. Your skin looks normal naman po. There is no redness or irritation. Do you feel any improvement po?
Yes, it feels less warm.
That's good. Then, clean and store the equipment. Now, I'm removing the waterproof pad po. Then, help the client to comfortable position. I will now cover your knee and I will be repositioning you po in comfort position. Then, remove the gloves and dispose off properly and perform hand hygiene. Identify any unexpected outcomes. So, there were no unusual findings po, or adverse effect during or after the care for the procedure. Now, I will document and report it po. Then, including the skin condition and the response of the patient. If you need something else po, call me right away po. Thank you po. Now, we will be performing a return demonstration of hot compress. First, perform hand hygiene and put a clean gloves. Family understanding. I will assess your family understanding so that I have awareness on your education about hot compress. Have you or a family member of you used it before? Okay. Then assess the vital signs and mobility of the patient. I already assessed the vital signs of the patient and mobility earlier. Everything is within the normal limits and she is safe for the procedure. Next is identify the expected outcomes. Ma'am, our expected outcomes is to reduce your back discomfort, relieve muscle tightness, and promote better circulation to help with healing and to evaluate the effectiveness of the hot compress. Then, explain the procedure and gain approval. Ma'am Flores, I will explain the procedure to promote understanding and your cooperation for the entire procedure. Your doctor prescribed a warm, moist compress to your lower back. Let me explain why. Hot compress help by relaxing muscles and reducing stiffness and relieving chronic pain or discomfort. However, there are times we do not use heat therapy, such as when there's an open wound, a first sensation, or has a poor blood flow in the area. Is it alright for me to begin? Then, describe expected sensation and safety precautions. This is the expected sensation that you will feel, ma'am, and to be aware and safe during the entire treatment po. You might feel warm, mild tingling, or relaxation in the area. But if you feel burning, stinging, or numbness, please inform me right away. The compress will stay on for about 15 to 20 minutes. But I'll be checking in with you every few minutes po. Then, position the client in seam's position and ask for her permission to expose her properly. I will only expose the area where the hot compress will be applied. Ma'am, it is alright if I adjust your clothing and expose only the area where the hot compress will be applied? I will make sure to keep the rest of your body covered for privacy. Sensitivity for any signs of redness, irritation, or loss of sensation. Then, inspect the wounds. However, there is no open wounds. Then, place a waterproof pad under the treatment area. Ma'am, I am placing a towel under your back to keep the bed linens dry po. Next, apply the washcloth to the warm water of basin and wrung out the excess to avoid dripping water, then apply it to the patient. Ma'am, I am applying the hot compress now po. Let me know if it is too hot or uncomfortable to reduce the inflammation and pain po. Monitor and comfort and observe skin during application. Ma'am, how does your back feel now po?
It feels warm but less painful.
That's good. I will check your skin every 5 minutes and observe your reaction closely. Please let me know if anything feels wrong and to avoid hot injuries like first-degree burn or redness or skin irritation. I will be right back at 5 minutes. It's been 20 minutes, ma'am. I will now remove the compress to prevent overheating and gently dry your skin po. Then, inspect treated area post-procedure. I am now checking your skin again, ma'am. No redness, no irritation. Did the compress relieve your discomfort po? Clean and store the equipment. Then, provide a privacy and reposition the patient. I will now cover your back and I will be repositioning you in comfort position. gloves, dispose of properly, and perform hand hygiene. Then, identify the expected outcomes. There were no signs of burns, ma'am, skin irritation, or adverse effect. Then, reassess the vital signs of the patient. I will check your vital signs again to compare with earlier readings. So, your pain earlier is 7/10. Can I ask you what is the level of pain today? 2/10. Then, I will document and report. So, your pain is 2/10. So, if you need anything, just call me on the call bell. Thank you, ma'am.